Washington just created a new funding stream for abortion, and whether you agree with it or not, you may be paying for it. This isn't rumor, it's Senate Bill 6182. Today I'm breaking down exactly how this bill works, how it's funded, and whether residents are being forced to subsidize something many morally oppose. Welcome back to Left Coast News. Today we're doing a deep dive into Washington Senate Bill 6182, the so-called Abortion Savings Program. This bill creates a dedicated funding stream for abortion services, and the big question is this: are Washington residents being forced to pay for something many morally oppose?
And this just isn't an emotional debate. This is a structural funding mechanism built into the health insurance system. So today we're breaking down what it actually does, how it's funded, and what that means for taxpayers and families across the state.
From Seattle to Los Angeles, this is Left Coast News. No apologies, just the truth. What the bill does. Senate Bill 6182 establishes something called the Abortion Savings Program. It creates a new account, the Abortion Savings Account, and the money in that account goes directly towards grants for abortion providers and abortion funds.
Specifically, the grants are meant to support direct patient abortion clinical care services, especially for individuals who are underinsured, uninsured, or unable to use their insurance.
So let's be clear, this is not a broad women's health care funding. This is targeted abortion funding.
Segment 2, how it's funded. Now here's where it gets interesting. The program isn't funded through the general fund like many other health programs. Instead, the bill imposes a new annual assessment on health insurance carriers.
That assessment equals 82 cents per coverage month in the first year, and then 16.5 cents per coverage per month annually after that. Initially, payments begin in 2027.
And while the bill says insurers cannot pass on the cost to the enrollees, anyone who understands economics knows when government imposes a cost on an insurer, that cost eventually shows up somewhere. Premiums, plan design, employer coverage decisions.
You can call it an assessment instead of a tax, but if it's mandatory, state imposed, and enforced with penalties, it functions like a tax.
No opt-out. One of the biggest concerns here is that there is no opt-out provision. No religious exemption, no employer exemption, no individual conscience exemption.
If you want health coverage in Washington and your carrier operates on the exchange, you're part of this system. That raises a serious question. Should people be compelled to subsidize something they morally oppose in order to maintain health coverage?
Whether you're pro-life or pro-choice, that's a legitimate civil liberties question.
Transparency and accountability. The bill also contains strong confidentiality provisions. The Department of Health cannot collect or release identifying information about individuals receiving assistance or providers involved.
Now, privacy protections in healthcare are important, but the concern critics raise is that this creates an insulated funding mechanism, a dedicated revenue stream outside the general budget process.
Which means less direct legislative oversight and less public scrutiny once the mechanism is established.
The broader issue? Now let's zoom out. This debate isn't only about abortion, it's about something bigger. What role should government play in resolving deeply contested moral questions?
Some argue this bill protects access and ensures equity. Others argue it forces participation in something they believe is morally wrong.
And in a state already struggling with affordability, housing, groceries, healthcare, adding new cost structures to the insurance system raises economic concerns as well.
So is there middle ground? Here's something important. There are people who oppose abortion broadly, but believe in stronger support systems, better prevention efforts, stronger adoption infrastructure, more resources for mothers.
And there are people who support abortion rights, but also recognize the importance of reducing unintended pregnancies and supporting families.
If we're going to move forward as a society, those conversations matter more than just shouting past each other.
Senate Bill 6182 is now moving through the legislative process. If passed, it would create a permanent funding structure for abortion services in Washington state.
Regardless of where you stand, it's worth reading the bill, understanding how it's funded, and asking yourself whether this is the right approach for a divided society. We believe in standing for what we believe in, respectfully, and trying to find middle ground where possible.
This is Left Coast News. Stay informed, stay engaged, and keep the conversation civil.